Have you ever wondered how to keep your patients coming back again and again in your practice without feeling pushy or salesy or gimmicky? If so, this episode is for you. We are going to talk about how to create a patient loyalty program that rewards your patients who are your biggest fans. It helps to build trust. It gives them something to look forward to when they come and visit your practice, and they will reschedule and book back with you because you have the best plan in town. I'm going to show you exactly how to do it. Let's go. Welcome to the Clinical Entrepreneur Podcast. I'm Rhonda, your no fluff, tell it like it is business bestie for wellness practitioners just like you who want to build a practice you love and make a bigger impact and a little money while you're at it. So if you're ready to ditch the overwhelm, attract your dream, ideal patients, and finally run your practice with complete confidence, you're in the right place. Each week, we're tackling things from programs to patient retention to marketing strategies that actually work, sprinkled, of course, with a little sass, a lot of heart, and the step-by-step strategies that will help you get there. So grab your cup of coffee, your notebook, or whatever keeps you going, and let's build a practice you love and a life you love together. Oh, I love this topic. Are you ready? We are going to dive deep into how to create a patient loyalty program and why loyalty matters. It matters more than it has ever mattered before. So before I get into it, I want to give you an example. So if you fly a lot or you travel a lot, or you know that you can get points, right? We get points on a credit card. If you have a points credit card, why do you use that credit card? Because of the points, right? You use because of the points. You fly with a certain airline. I live in Seattle right now, and my real home is in Las Vegas, but I have a second home here in Seattle. And so I'm in Seattle. So the airline that I fly on is Alaska. I fly on them, and I will go out of my way to get on a flight with them. Why? Because I want the points. I want the status. I want my points because my points are going to get me a free trip somewhere, or they're going to let me fly one of my kids somewhere with me, or I want the points. I want the rewards. And I like Marriott. So I have a Marriott. I actually have a Hilton Honors account as well. And so I fly with them. When I have to rent a car, I use budget. And some people don't like budget. I don't care. I have a rewards program with them. And so I will go back to budget every single time because I want the points. I want the thing because I'm going to get a free day, or I'm going to get a free car, or like my credit card. I have lots of points, and I could use my points to go on a trip, go on a cruise. I could buy a Vitamix with my points if I want to. I mean, there's all kinds of things. So loyalty is huge, but we don't talk about it in clinical practice, right? We just don't talk about it. So always the objection when it's come up, and I've had this issue before, but I did check. And the objection is that you can't do this with healthcare. You're kind of right on that. You can't, because we can't give loyalty kickbacks, not loyalty, but can't give kickbacks and money and all the stuff if it's under an insurance type program. But the thing is, my friend, is that you and I have a cash-based practice, and it doesn't apply. Those rules don't apply. The kickback rules don't apply for a cash-based practice. They only apply if it's insurance-based. So if you have a cash-based practice, then this podcast is for you. And if you have a part cash pay, part insurance, then you can even create a loyalty program. And I'm going to tell you how to do it. But you create this loyalty program, and the loyalty program allows your cash patients to participate. And if you have insurance patients, you just say, I'm sorry, I can't allow you to participate unless you convert to cash. Sometimes they might. I don't know. They may not use their insurance. Little different if you have Medicare patients. They definitely don't apply. But we're going to just go with cash-based because most of you all listening have cash-based practices. So now you kind of have the context for this, right? Bonuses, points, loyalty, it's all the thing. Everybody wants a point. You do have it in your life, so you understand the concept. So why don't we take that and apply that to our practices? Let's talk about it. So in your practice, it costs a lot to get a new patient. It costs time if you're running ads, which most of you aren't running ads. And I get why, I understand why, but like word of mouth, getting the word out there, finding out what's going to work and how you're going to get new people in, and maybe going to like do a health talk or whatever it is that you're going to do, right? You're hosting something in your practice, whatever your marketing strategy is. But it takes time and effort, and it also costs money. So getting new patients is not free. But retention is where the gold mine is. It's retaining the people that you have. It's letting them not get away from you. And the way that you do that is by creating brand loyalty. That's why I fly on Alaska. I don't like flying on Southwest because A, I don't like Southwest, but B, I don't like their rewards program. It's crappy. Alaska treats me like a queen, and I love that. So how can we do this in your practice and allow your patients to really feel like their loyalty means something to you? Let me tell you, you might be looking at the dollars going, well, I'm going to get to that part. I'm going to show you like how it works. But when we get there, you might be thinking, oh, well, I can't do this, and this is going to cost too much money. Okay, fine. You let all those patients go. Just let them drop off. You just go ahead and do that. And then let me know how that works out, because then you got to go acquire new ones. And it's way more expensive to acquire a new patient than it is to just harvest and capitalize on the gold mine of existing patients that you already have. And those could be past patients or your current patients. So you can market your loyalty program to both. So functional medicine, you know this, like our wellness perspective, it takes time. You can't recover all the things that are going on wrong within just 2 weeks. So patients drop out for a lot of reasons. Life happens, or they don't have enough money or whatever. But when they have a loyalty program, when you've got a loyalty program in your practice, where are they going to come back to? They're going to come back to you because they know they have points, or they know they have a reward coming, or they know they have something coming. People love the reward game. So what does this look like in a functional medicine practice? Well, it's just basically a way to structure a program, something you can do that helps the patients get incentivized for their ongoing engagements, like healthy behaviors, and their long-term commitment to their care with you. It's not, I don't think a loyalty program is like a punch card. There used to be those, and some coffee shops have them, right? Or you go somewhere, you're like, I'll give you a punch every time you get it. That's not that. The goal here is for us to figure out how we can deepen the relationship between the patient and the provider. We want to encourage more interaction, continuity of care, make the patients feel really valued for their participation, not only in your office with your practice, but also investing in their own care. So we want to incentivize them for the things that they're doing for themselves as well. So not only are we going to build loyalty, increase patient retention, but we're going to reinforce positive habits and then be able to build a thriving community of people that love you and they love what you do. And it keeps your revenue up because they're coming back. So unlike like a traditional, well, we've talked about before, like fee for service, sometimes patients will just drop off. A loyalty program keeps them engaged, yes, but it isn't as much about like, them spending. I mean, they can redeem their rewards. I'm going to talk to you about what that looks like in my examples. But it's about, we want to reinforce good behavior. Really, that's what we want to do. Because when we reinforce the good behavior, they feel seen, they feel valued, they feel like they're part of something, and they know that other people that go to your practice, they're in the rewards program too, right? And it's fun, and you make it fun. And then they're more likely to refer and leave you a review and like, oh my gosh, this was so great, etc. And it helps to differentiate your practice. I think that's a huge one right there. Who do you know that's doing this? Who do you know? Not very many people. So I went on a little website hunt. I did not use Chatty for this, but I just kind of went out and I started hunting. I started doing Google searches for, I did like chiropractic loyalty programs, acupuncture loyalty programs, health coach loyalty programs. And of course, I was met with, some of the junk. I had to go to like page 2, 3, 4 to find them or were further in the search, but I wasn't able to find very many, but there were some that were out there. There were definitely some out there, and they have a whole page on their website about their rewards program. I thought, dang, nobody else is doing it. So now in your little town, your big town, wherever you are, you start creating this loyalty program, and all of a sudden the patients want to come back because they want their dang points, because that's what we do, right? We want the points. We want the rewards. So, all right, let's dive in a little deeper. There are 4 types of reward programs. The first one is the one that I like the best. And then I'm going to give you the other 3, but we're going to come back to this one. And that's the points-based program. So basically, patients earn points for actions that they take. And those actions are either going to A, benefit your practice, or B, benefit the patient. That's it, benefit their health. Because we're trying to keep them on the health train, right? So we want to incentivize them to do something that's beneficial. So for instance, you might give them some points when it's their birthday. Like, that's a nice, generous thing you could do. Or the anniversary of them working with you. Or maybe their real anniversary with a spouse. Maybe they get points for every time they come in for an appointment. They get 10 points. Or if they schedule their follow-up when they're in the office, they get an extra 10 points. Just schedule it right then. If they refer someone, if they leave a review, remember this is cash-based, cash-based. Don't get your panties all in a pinch about this because it's only for cash-based practices. If they leave a review or they like you and tag you on social media, that's another one. Like they could, tag you on another post or something. Maybe it's joining your email list. They get some points, or they've downloaded a resource, or they've showed up for every appointment, or they bring in their spouse. You can choose. I've got a whole list, in fact, at the end, because this episode is part of our 12-month business growth plan series. We're on month 8 right now. Got a resource with all of this. So the first type of loyalty program is points-based. The second one is tiered. And tiered is like, level 1 is the bronze level. And this is where you get, a free visit plus 1 supplement plus 5% off. And then the next level has this in it. And then the third level is the gold level. And that's for X, Y, and Z. I think it works. I think it's a little bit more to manage. And I think that the fun isn't there. Like, I guess that's how an airline works, but I don't fly. I mean, I might fly once a month, but I'm not flying like every week or anything. And I get big points when I fly. These are little points for little actions because it's the little actions that happen in between that I want to keep track of. I want to incentivize them, not so much with like dollars spent, although I think that's a valuable thing to incentivize if you want. But I don't like the tiered program as well. I like the actual points. It feels more like real life for me. The third type is value-based. And this is like if you complete a 3-month stealth pathogen protocol, that gets you a special gift. Or you show up on time for 3 visits in a row without rescheduling, that gets you a gift. I don't like this one at all. I just don't think it's a good one. The fourth one is a subscription-based, which is a membership. And I know some practitioners who do have memberships, and those memberships, that's fine. They pay a recurring fee, and maybe they have VIP access to you, or they have access to recipes. Or if you have, in Clinical Business Academy, we talk about it as the happy room. The happy room is a non-attended therapy room, and people can have a membership to your happy room, and they could use it once a month or twice a month, and they just come in and they use it. It could have like a sound bed or a salt room or infrared light healing or whatever sound. You do your thing, but it's a non-attended room. That would be like a membership, right? If you have, like I know a practitioner who teaches Pilates in her chiropractic office. So maybe she has a Pilates membership, or it's a chiropractic or a wellness membership with all the things in her practice. So you can, all that is a membership. That one also is a lot of work up front, to create the content and get it uploaded and on a platform, et cetera. So back to the first one, I really do like the points program. I think it's easy. It's fun. The patients like it. They can kind of see like, where am I at? How many points do I have? What can I redeem my points for? It's just kind of a fun thing to do. So before I get into how to structure it, there's a few do's and don'ts that I want to cover first. First of all, the don'ts. Do not incentivize purchasing something that's not appropriate. Like, have integrity. We want to have integrity with this. Don't promise health outcomes in exchange for a reward. We definitely don't want to go. We don't want to go into that territory. It's okay to incentivize an action, but don't promise a reward, an outcome, and then give them a reward. And then always, if you're giving them points for leaving you a review or making a referral, but especially a review, just make sure that you're HIPAA compliant in your responses. And the way that you are best HIPAA compliant is to respond as a third party. In other words, you don't know them, but you don't know if you know them or you do know them. You don't know, you're a third party, you don't know. So kind of like talking about someone, like, I'm so happy that you found your dog. I love it when people find their lost dogs. I didn't say you, or in that example, when people find their lost dogs, I'm just talking about in general. So if I said you, I'm not going to say, it was so nice to see you in your red dress today, and we're working on your adrenals. I can't wait to hear about how your Aunt Martha's graduation from college at 83 goes. Do you get it? Because now we're tying her. We know information about her. Now everybody knows she's a patient. You just have to respond like you just don't even know them. We're so happy to hear that you love your results. You're happy and you're finally able to really enjoy your life once again. Neutral. So not saying I know her, not saying I don't know her. I'm just middle of the road. That's the correct HIPAA response to a review. So just make sure you follow that guideline. Sorry, little mini training there. And then don't tie rewards to maybe necessarily a clinical issue, maybe more something that they complete, like they've completed something, not, you'll see what I mean when I get to it. Never mind, I'm gonna skip that part. Okay, here's the do's. You ready? For your loyalty program, you need a fun, catchy name. It can't just be the Dr. So-and-so's loyalty program. Come on, you can do better than that. So we want to have a fun, catchy name. Add it to your website. Make it easy to track. You could do a punch card if you want to, or you could just track it manually. You can just make it personal and fun, not salesy or anything like that, but just kind of make it a fun thing. Patients love that stuff. And then it could be, you can add in things like what I call low lift rewards. And that's like a little bag of herbal tea. Like maybe go buy some herb tea bags that you like and just give every patient that day, just like you join the loyalty program and you get a tea sample and a surprise lymph brush. I don't know, whatever you want to do, but make it fun. Like just make it so that they're incentivized to want to participate with you. And then remind them that always in a rewards program, like you don't want them doing something that they don't want to do just to get the points. Like I have been known, I'm going to admit, to make a cross-country flight and then pick up the flight and return in order to keep my status on Alaska Airlines. I have done that. Serious. I did it. Flew to Atlanta and then flew back. I went there, got off, checked back in, got back on the same plane and flew right back to Seattle because I needed the points to keep my status. I can't help it. That's what I'm talking about. People will do this. You don't think they will, but they will. And then make sure that you have like some terms and conditions. You probably use ChatGPT. Once you outline your membership, you can use AI to say, hey, help me write some terms and conditions for the membership, and just put that in the fine print, make sure that they see it or they have a copy of it or whatever. All right, now, last thing before I get into the how-to, make sure that you have some kind of a disclaimer that this, applies to cash-based patients, cash pay patients only. It does not apply to Medicare or other insurance patients. And then also, it's for patient appreciation and is not a substitute for clinical recommendations. So you want to put those couple of things in your disclaimers. And then, I would be remiss if I didn't say, be sure that you check with your local state board, local board, any kind of licensing body, just to make sure that you're okay to do that. If you're a cash-based practice, there may still be some requirements. I don't know, but you're going to have to check in your individual state. So, all right, now let's talk about how to build it. First, you're going to decide how you want to keep track of it. Don't overcomplicate it. Just use paper to start with, because you're not going to have 100 people that are going to jump on right away. You might have 2 or 3 or 5 or 10, and it's okay. Keep track of it manually. You can do that. So you could just use a Google sheet. You could use an Excel sheet. You can use there's some rewards apps out there. I checked on a few of them in preparation for this podcast, and there was only one that I was moderately happy with, but it's $700 a month. So I kind of think that's a no. If you want the name of it, I'm happy to tell you, but I'm not even going to bring it up because I wouldn't pay $700 a month for it. So first you want to decide that you're going to just track it, right? We just need something to track it on. Now, the next thing we want to do is define the actions that are going to earn them points. And the sky is the limit. You can work with AI and get some other ideas, but I'm going to give you a list of them, and this is actually in the resource for this 12-month growth plan, business growth plan. And the link, I'll tell you now, is rondanelson.com/12-month growth plan. So the number 1, 2, and then month growth plan. rondanelson.com/12-month growth plan. And go to month 8. So you'll see all the months on there. You can go download all the things, but this is month 8. So this over the past 8 months, I've been giving you every single month a different strategy to grow your business. So if you missed out on them, go back and get the numbers 1, 2, 3, 4, 5, 6, and 7, because we are now on month 8. And this is building patient retention, and we're using loyalty programs to do it. So I'm just going to give you a few things here, but the rest of these are all listed in that resource under month 8 at that URL. So for instance, you could give them points for, as I mentioned, scheduling an appointment. What if you had a patient feedback survey and you said you get 50 points when you fill out the patient feedback survey? People are like, okay, sure, no problem, I'll fill that out. And they're happy to fill it out because they want the dang points. So you want to think about what is it that you want from the patients? Well, for me, I want those surveys. I want feedback. I want reviews. I want referrals. I want testimonials, and I want them to show up, and I want them to do what I'm asking them to do. That's all. That's really what I want. So I want to incentivize those things. You could incentivize them, like if they complete a 21-day purification program. If they complete it, then you could, if you wanted to, you could reward them for that. You could reward them. I know one practitioner who gives them $1 for every supplement, every dollar amount of supplements that they purchase. They get $1, or I'm sorry, not $1, 1 point. So if they order $200 worth of supplements, they get 200 points. That's going to rack those points up fast. So you have to make sure that all your other ones are, relative to that. You wouldn't want to give points for supplements like that and then do 5 points for showing up for your appointment. That's a big disparity. So you have to adjust your points. But I do know one practitioner who does that. Let's see what else. A video testimonial. Those should be worth a lot of points. Those get you so much more social feedback and engagement, and it's great for videos are the bomb. So you should give good points for that. If they attend one of your events, or maybe they reach a personal wellness goal, maybe their goal is to drink more water and you're having them use a water tracker. I mean, there is the honesty, kind of the trust factor we have to build in here. Maybe you're hosting a community event, or in the summertime, you're going to go take a hike and you want to invite your patients to go with you. It's kind of an organized thing. They get points if they show up for that. Or if they come to you and they tell you that they're volunteering for a local charity, you can give them points for that. Or you see them or know that they did a random act of kindness. Like, just be generous. Just be a generous human, right? Give them points for all kinds of things. Like, I can get points on Alaska for renting a car, staying in a hotel, flying, upgrading, not upgrading, ordering food, putting it on my Alaska card. I could do all of those things. So just be creative and think about what you want to give them points for. Then step 3 is to choose the rewards. You have to do the things and then assign the points, of course. And then you choose the rewards. And AI can help you with this. I'm telling you, it will help you. So the rewards, these are just a few of my ideas, but things like you could give them when they reach a certain point level, you could give them a $20 gift certificate towards a massage. And that massage might be in your office if you have massage therapy there. That's great. It could be towards $20 at a yoga studio if you have a yoga studio in town that everybody likes. Or you could just give them, I wouldn't just give them $20 cash. I would give them a gift certificate. Or you could just give them a gift certificate to use whatever they want in your practice. $20 could go towards supplements. It could go towards your visit. It could go just $20. That's it. But don't give them a $20 bill. Have them spend it with you or somewhere else. You could give them a happy room. I talked about that. You could do a 25% off your next consultation. That could be a reward. You could do a free supplement, like up to a certain value. You could do a free lab test. You could reward them with extra time if you have like a traction or something like that. Some, in office, something that you do if you're a chiropractor, or a little bit longer session. There's lots of things you can reward them with. But things that are kind of fun and interesting and engaging, you could even create like a custom, you want not just little rewards, but people save their points. Like me on my points card, my credit card. Oh, I'm saving those points. I am not going to spend them. I save them. I'm thinking when I retire, I want my points to be there so that I can fly where I want to go and I don't have to use my retirement. That's why I'm thinking, right? Or I want to fly my kids somewhere and take them all on a cruise or something. So I'm kind of protective of my points. My husband, he spends them like they're water. I'm like, okay, well, I tell him, I may not fly you with me because you wasted all your points. I have my points now. He just laughs at me. But the people will save them. So you may want to create something that's really big, like a big basket or a free 1 month of free protocol supplements. I don't know, whatever you want to do, but it could be a half a day at the local spa. Maybe you have a big spa in town and you want to reward them and let them go do that. It's okay to not have all of the rewards kind of tie back to you. You want to be a good neighbor and support the other business. And then if you do that with their business, with this local spa in this example, they may be willing to kick something back your way and do something for the people that attend, that they come back, they'll give them some perk if they come see you. So there's always ways to work it out, but choose what you want to offer as rewards, but just make sure that you're not giving away too much. The point is you want to think about like, what's the revenue that you generated by having them stay with you? And it's okay if you give them a $20 gift certificate. It's okay. Like you made the money because they're sticking with you. So, and it's loyalty and brand awareness and all the things. And then, step 4 is to talk about it, just promote it. The best way to do this is you want to have like kind of 2 parts. Number 1, what you can do to earn the rewards, and then what the rewards are. So the name of your rewards program or your loyalty, I'll call it loyalty program, the name and what it's about. And then here are all the things that you can do to get rewards and their points. And there's no limit to the points. You can build them as fast as you can, as you want to. I don't care. They need to be tied to something that's making you money though. Don't put too many of them on like go on a hike and get points because you're going to go out of business if you do that. They have to be tied to something they're doing that's generating you revenue because you're the one that's giving them the reward. So then you're going to just put the second one, you're going to put what all the rewards are. And then they know what to choose from. It's like if I go to my, credit card, I look and see what their rewards are. And I look at the Vitamix and I think, oh, maybe I want to spend points and buy a Vitamix. You want to have a nice picture of what it is that they'll get. And then lastly, once you make it really easy to understand, you want to promote it. It should be easy to talk about within about 30 seconds. You should be able to talk about it easily. Talk about it in your new patient onboarding. Listen, as a patient in our office, you're automatically enrolled in our rewards program. Here's how it works. There's no commitment, no obligation, but you do earn points when you're here. And it's the, Finley's Fun Fitness Rewards Program. I don't know if you're a, weight loss something. You name it. Give it some kind of a fun name. And then put it on your website. Talk about it with your patients. Share it on social media. And then be sure you celebrate, when they win something. Like, tag them or something. I don't know. Well, actually, you couldn't do that because then that would not be cool. You cannot tag your patients. Do not do that. But maybe they'll tag you. They can do that, but you can't respond like you know them. But you want to just celebrate it, make a big deal, send a handwritten card or make a phone call or like, congratulations, you won the basket, or here your $20 gift certificates coming your way at your next appointment, or whatever it is. So there you go. I have all of this laid out. I've got name ideas for you. I know, but you can pick them out, but hopefully they'll kind of kickstart your brain. You can pick one that works for you. And then I have ideas for you about the types of things that they can do to earn rewards. And they're not going to all apply to all of you, and that's all right. And then I have a list of things that you can give as rewards. So to get that, you want to go to rondanelson.com/12-month growth plan. So 12, the number 1, number 2, growth, 12-month growth plan, and look at month 8. Okay, we're in month 8 of our 12-month business growth plan. So just don't overthink it. Start with something really simple. You don't have to, you can have like 5 ways you can earn points and 5 rewards that you can get when you earn points. And I have it all listed out in that free resource. So go get that patient loyalty guide. You can download it. It's just opt in, get it, and it's yours to have. So there you go. That's it. So remember that acquiring a new patient is a lot more expensive than keeping the ones that you have happy and engaged and interacting with your business. These, back to the credit cards, they spend, the last number I heard, it was like $500 for a credit card company to get a new customer. That's what their cost per acquisition is, $500 to get a new cardholder. And you get all that junk mail in the mail. They pay for that. That's all part of that. And they are trying so hard to get your business. And what we want to do is, once they get my business, I'm not going to go anywhere. I've got my credit card. I'm going to keep using it because I got all these points on it. If I don't use it, I can't use the point. I can't. So we want to keep them. We want to incentivize them, but we want to engage them and help them help us to build our practices, right? We want to help them by motivating and incentivizing them to help us be able to reach and impact more people. So just start small. Don't get overwhelmed. Just get like a little Excel sheet. That's the other thing that's in the month 8 resources, is just a super simple tracker that'll help you kind of track the rewards for your patients, like how many they've earned, and then what their reward, if they redeemed a reward. So you can kind of see where they're at and what their total points are. It's very, very simple. You don't need to make it complicated. If you have a practice management software, they may have the capacity to do that. I don't know, because I don't know what you're using, but let the loyalty program do the heavy lifting for you, because once your patients you've kind of gamified it a little bit for them, I think you'll be really surprised. It doesn't cost them anything and they get a lot out of it. I think you'll be surprised at how many people will take you up on it. So there you go, my friends. As usual, I'd love to have you in Clinical Business Academy. You hear me talk about it all the time, and that's because I'm so passionate about it. So if you want, I would love to chat with you about your business. If you're struggling with patient retention, growth, marketing, that kind of thing, let's get on a call and we'll talk about it, and we'll see if Clinical Business Academy is a good fit. But this is the stuff that we teach inside the program. So I would love to have you. Anyway, have a great week. Talk to you next week on the podcast. Take care.